You are now listening to Nailed It, the Orthopedic Surgery Podcast.
And okay, so just going back, so our longitudinal tears we'll see because it's kind of like a straight up and down line, of increased signal in our meniscus that you'll see on T1 and T2s. Now, how do you tell the difference between that and a buckle handle tear?
So bucket handle tear obviously is a more significant injury because that tear has propagated to an extent that it's flipped out of place. From a clinical standpoint, these patients are going to look different, right? It's not just going to be rotational type pain with twisting or catching, locking type symptoms. These often come into the office with a locked knee. If you see that central image, that's that double PCL sign, right? So you've got the black thick PCL in the back, and then you've got what looks like a little sister PCL underneath it. That's a flipped portion of meniscus coming over into the notch, sitting underneath the PCL and often pushing the ACL out of the way. So that, again, clinically is going to be significant and also factors into your time to get to the operating room being a little bit more urgent. But that's what you're going to see on the MRI. You're also, as a corollary to that, as you get out toward the periphery, you're going to see an absence of tissue in the periphery because that tissue is no longer sitting where it's supposed to. It's sitting in the notch. So you're going to see a smaller triangle out in the periphery because tissue is not there where you expect it.
Right. So kind of like right here, we should expect like a little bit more black signal here, but just we have that increased white fluid there, and our meniscus is flipped over into the notch right here, which is this black line.
That's right.